ahead on to our next session. This is on innovative technologies for futuristic healthcare. We are pleased to welcome Mr. Joy Chakraborty, Chief Operating Officer, PD Hinduja Hospital, who will be moderating this session. Welcome, Mr. Chakraborty. Thank you so much. Joining him in the session is Ms. Suparna Sengupta, Chief Executive Officer, Narayan Memorial Hospital. Welcome, ma'am. Can we have a round of applause, please, for our speakers? Ms. Manisha Kumar, Chief Operating Officer, HCG Hospitals. Welcome, ma'am. Mr. Dr. Charu Dutt Arora, Founder, Member and Head Consultant, Asian Institute of Medical Science. Welcome, Doctor. And Mr. Sudhanshu Mishra, VP Business Development, Ozonetel. Welcome, sir. So over to Mr. Joy Chakraborty for taking this session forward.
Good afternoon to all of you. I hope all of you are awake and listening to this interesting session of futuristic healthcare. So, since morning, I'm sure all of you are attending heavy sessions loaded with knowledge and so much of practical experiences, whatever have been shared. To now, we are embarking into a discussion where we are going to have industry leaders who are going to talk about the futuristic technology, its application in healthcare. I think for last couple of years, during COVID, even before COVID, we spoke about technology, new technology, how we can get rid of this challenging situation, what are the new technologies. A lot of new technologies have in fact come forward, and more than new technologies and application, we have seen several companies, startups, they have got into it, and probably that is the reason why the way we anticipated the impact of COVID is going to make in India, in Indian healthcare, that didn't happen. Not only in terms of healthcare technology, whether it is medical textile, whether it is making reagents for test, so many things have happened and we have shown the way. So with this background, I am getting into the discussion with my panelists here, and already have got introduction of all of them. So I'll start with Ms. Manisha Kumar. She is from a chain of hospitals, and my question to her is going to be that in last 2 years, we have seen a lot of technologies, new, old technologies got changed, modified. So can you give some examples of what you have done in your hospital in terms of this new technology, and what is there in the pipeline, and you think we should adapt and we should, adapt in terms of making healthcare delivery much better and efficient?
Thank you, Joy. Good afternoon, everybody. I attended a very engaging session just before that by our CIOs. So at the cost of repeating some of the things, but more from a provider perspective, I think in the last decade or so, there has been entry of a lot of technology interventions, enablements in healthcare delivery. The likes of teleconsultations, virtual consultations, telemedicine, teleradiology, and so on. But the adoption by the providers, practitioners, patients, as well as payers, these are the 4 Ps of healthcare, as I say, by all of them was slow, there was a little bit of reluctance, hesitation, and so on. But last 2 years since COVID struck us, we have seen enormous disruption that has come about in healthcare, especially in delivery of healthcare and how we deliver to patients. And I think all these technology enablements that were facing some sort of a roadblock, a mental roadblock, were able to overcome it, and there was a steep hike in adoption that we saw. So all of us hospitals, we had to resort to doing virtual consultations, teleconsultations in a matter of days, some of us in a matter of hours, because we wanted to keep continuity of care with the patients. We wanted to take care of more and more patients. We did telemedicine, teleradiology, at least the reporting bit, most of us did. We also set up EICUs. We set up EICUs, or I would say step-down ICUs in a hub and spoke way, because we had far larger number of critical care patients that we had to cater to with the same amount of resources. So really the limiting factor in these times was the number of doctors and nurses, and we all felt a paucity of, and at a later point of time was equipment as well, but we all felt a paucity of this critical clinical talent as a resource, and that is where technology came in to actually help in this, to mitigate this crunch, so that we could actually cater to 2 times or 3 times of our capacities. So tele-ICU was one such thing which a lot of multi-speciality hospitals ourselves we adopted. And we also had home care, home quarantine care of patients and so on. I think there is a very interesting theory of disruptive innovation which says any new entrant in a market, if they want to disrupt it, I'm just telling an abridged version, it's a Harvard study, actually a large study, but any disruptive technology, when it enters a market, it would be successful first by targeting the low end of the market, which is an overlooked segment. And you know, it would be successful in capturing that segment by being very accessible, convenient, less expensive than the established incumbent players. And once it takes over that segment, it quickly grows up the ladder and takes a larger market share. And I think in terms of healthcare delivery, this segment has been primary healthcare. We should not mistake for it, it's not as small. More than 50% of public health expenditure is in primary healthcare. But in terms of focus from tertiary care hospitals like ours, for various reasons, for profit margins, for focus of consultants, we have never focused as much on primary healthcare. And this is the segment which is getting disrupted. And now I'm talking not just COVID, but post-COVID. Most of the health tech innovations companies that have come in this segment of primary healthcare, and COVID has simply been a proof of concept where we have seen the entire outpatient ecosystem in a way migrate digitally and becoming accessible to the patient in a digital format. So I think as providers today, we have realized the importance of this as well. Whether we want to focus on it or not, we understand that it is beneficial to give a single digital interface to a patient, which is simplistically put like a single digital front door, wherein all the entire outpatient ecosystem, whether it is booking appointments, triaging an outpatient, consultation, e-pharmacy, telemedicine, diagnostics, everything can end-to-end can be delivered as a value proposition to patient digitally. And I think this is the single biggest disruption which a lot of new health tech companies are doing. Large players, large healthcare providers, corporate hospitals are developing in-house or partnering with some of the organizations and taking this up. I think the other piece is data. And what we have, we all know already, this is not a slow realization, we've always known that we are sitting on a gold mine of data. We have a lot of wealth in terms of rich data. It's just that we don't analyze, we don't crystallize, and we don't take rich insights from it to put to any sort of action. And I think this is where organizations such as ours, and I'll talk about myself, I worked in multi-speciality hospitals in the past and currently with the cancer specialty. But everywhere large healthcare providers, hospital chains, are now looking at how to effectively use this data. How do we analyze it? So we are getting into big data analytics. We are partnering with tech companies who are helping us build CRMs. There are powerful business analytics that are coming into play, so that we are able to use this data not just to develop better treatment pathway for patients, not just for clinical research, but also to get real-time insights, so that this can help in growing our business itself, so that we can reduce our patient acquisition cost, keep continuity of care, reduce the cost of healthcare for the patient as well. So I think this is the second big focus area. And lastly, artificial intelligence. It's a very thrown around word out there, but underestimated, because initial days for us, at least in Indian healthcare, But coming to HCG context, we are partnering with some of the largest medtech companies of the world to develop AI-powered diagnostics in radiology, so that, just as an example, when there is a CT scan or an MRI that is done, instead of a radiologist sitting firsthand and contouring the tumor, the AI-powered device, the software capability is there, so that the system itself, the radiology information system itself, contours the tumor, and the doctor is simply validating. So therefore, it reduces the the turnaround time. It reduces the time a particular radiologist is spending in front of the system. Also makes the treatment that much more precise, and so on. So I think artificial intelligence is the third one. And at a high level, these are some of the innovative disruptions that are happening in our hospitals.
Thank you very much. And I think you have covered, starting from primary healthcare to data to artificial intelligence, probably the entire ambit of the new technology, whatever we are getting familiar and we are getting to see. And of course, the part of teleconsultation you have mentioned, it has become very popular. And I have seen in my own hospital and some of the hospitals nearby in Bombay, that when there was no or next to zero video consultation, teleconsultation was in practice, today they have started loving it. And after the second wave, there was a study by one of the big 4 consulting firms on the teleconsultation, telemedicine. They asked question to the patients. Close to 60% of them, they said, yes, we'd love to continue with teleconsultation. And close to 73% doctors responded, they have told, we will love to continue with this, because in this way, we are able to reach many people whom we are not able to reach before. So I'm sure that is going to be the way. Very subtle way Manisha has covered about home health care. So I'll take the clue, and which has not been discussed much now. I'll go to Dr. Charu Dutt, and we'll ask him, what do you think the future of home health care in Indian scenario? Because that also needs to gear up, that also needs to improve in terms of making healthcare really accessible, not from affordability point of view, but in terms of making sick people to get the right care at home when they can't travel to a hospital, or they need not to travel to hospital and consume the costly resources. So what do you think about the future of home health care?
So thank you so much, Joy, for this question. And thank you, Manisha, for covering most of the components of the futuristic technologies in healthcare. So just a brief introduction. My name is Dr. Charu Dutt, and I am basically a critical care physician by educational background. And currently, I am heading one of the biggest departments of home healthcare in Delhi NCR. Now, a lot of people really ask me, why home healthcare? It looks very unorganized. It looks something which is not at par within Indian standards. And some people still think that, a little low below the threshold quality of care is, it's not an equal efficacy of care which is provided at home as compared to the hospital. So what's the function of a doctor who's specializing in this domain? But actually, for me, the future of healthcare, forget the technologies, forget the, the innovations, forget the entire, so many technology or, software which are coming in. The future of healthcare is as simple as it used to be in the 19th century or the 18th century. It's at home. Because if you look at the studies, she put it correctly. The primordial focus is going on preventive wellness. It's from cure to care. And if you look at the numbers, the senior care or the home healthcare market, I would say, is growing at a compound interest rate of almost 19.5%. In 2021, it was at a 7.2 billion USD, and it's projected to reach, by 19.27 CAR by 2050. And so is the number of senior care in India, the number of senior people in India. When just like us, we do not now call any restaurant, we do not call any restaurant to order food from. Not only COVID, even before that, since the inception of so many food delivery outlets and handheld systems, nobody knows where the food is coming from and who's bringing in the food. We just know that we order it through this app. And similarly, with the disposability of healthcare, just like entertainment, retail, and hospitality, the future is coming at home. The aged population is going to increase. And yes, with an augmentation of all the AI, big data, and machine learning softwares, it becomes more seamless, more kind of a proactive rather than less reactive. So with this approach, with home healthcare system, there was a point when a single physician sitting in Faridabad in the second wave was handling 275 patients on ventilator. Again, I'm reiterating, there are 275 patients on a non-invasive / invasive ventilator support during the second wave of COVID only at their homes. And this was a huge number because we had a continuum of care. We were getting constant communication through all the personnel, healthcare personnel involved, whether was that a pulmonologist, whether was through a junior doctor involved, whether was that a critical care physician, infectious disease specialist, a nurse, a caregiver, a physiotherapist, a psychosocial expert, everybody was involved through that one software. And later on, when we understood that what kind of care was given, it had a good it had a good touch to the the golden standard as well. But as it was discussed in the previous session, I think the attitude of the physicians needs to be changed. They are still very reluctant in using telehealth services. They are still very reluctant in understanding the knowledge, attitude, and the practice of telehealth is still at a very, very premature stage because forget the home health, even in the hospital, you have all the major hospitals have their apps to integrate the patient to the doctor. But they still think most of the consultation, most of the prescriptions have written to come to the hospital after 14 days or 7 days with these blood reports or these diagnostic tests. There still is a mark of seeing the patient. But if you understand it correctly, the number of doctor visits are going to reduce because the people are going to stay at home. But people do ask me, is the humane touch or the human touch going to lose its significance? No. The human touch at home is going to increase the humane aspect because the people who are really required to touch a person, to care for that person, are still going to be in practice. A person will still be required as a nurse to do a wound dressing. A person will still be required as a nurse or a counselor to do a bereavement and a grief session. A person will still be required to do physical therapy. But what might not be required is a doctor who wants to see the patient because there's so much of data which can be inserted in the software and a branch of it which is called as predictalytics. So a lot of it with the human facial expressions or the tone or the symptomatology or keeping in mind also all the omes, whether that's a proteome, genome, physiome, everything can be inserted in it and you can find a predictive diagnosis which can be easily interpreted and then taken care of. So yes, from my side, home health care is one of the futures of healthcare industry, and apart from that, it can grow only if there's a complete seamless integration of all the technology and the personnel involved, and for that, awareness and education is the key.
Thank you, Dr. Charu Dutt, and if I'm not wrong, you are a doctor, right?
Yes, absolutely.
And
I'm a practicing physician.
It was music to my ears to hear from a doctor that doctors have to change the attitude.
Absolutely.
So
What's wrong
I'm
with
sure the audience who is here, all of them will agree that that is a point what all of us are looking for, and that is becoming a challenge. And I'll take the clue from there and I'll go to Suparna, my next panelist, and I'll ask the question. She spoke about telemedicine, he spoke about home health care. We have heard since morning a lot of things about digital where EMR and all were coming into discussion. So when you were planning to implement and getting into this kind of platforms, I'm sure you're coming across a lot of challenges. So what are those challenges and how you were thinking of mitigating those?
Hi, thank you, Joy. And that's a very googly kind of a question because I mean, healthcare has always been a kind of a challenge. I don't know why it is like that. When we sell health, I mean, we sell health. So it's like we do not, here we are not selling health. It's something we are trying to absorb in our system. So its challenges are basically to, motivate people that you need to do you need to do this. So I think the clue is from Dr. Dutt that the physicians are the main challenges in electronic health records, because even if I maintain a data and I go to my CTO and say that you need to do this for me, or I go to aggregator, I take a outsource agency, I do everything. But whether they are keen to access those records, and even if it is available on them on their smartphones, how many of them are actually accessing to it? Still they would call a nurse or the MRD guy and say, get me the file from 1988. So thankfully, 1988 is not there, so 7 years is there. But I would really, Joy, I think that this Arogya Setu has opened, a lot of eyes, because now the doctors are depending on data, and they are like, okay, you feed me this, you give me this, and then I can, I can come back to you with a prescription. So the main challenges of the hospital, I'll just, coming out from the physicians, in the hospital what we are mainly facing is, the second tier, because I was just hearing somebody on the other conference somewhere, that they are saying that there should be a two-tier healthcare system. There should be the nurse practitioners, and then there should be the consultants. They're completely trying to abolish the system of the junior doctors. So they are the main people who are actually the disruptive thing, what you say in a hospital is actually them, because we have got this concept in the place that you need a RMO doing the rounds. But do you really think that sometimes our nurses are better than them? They get to the consultants on a better way, they can narrate better, they are monitoring the patient much, much closely than a RMO. Now you see, for a resident doctor, the clinical establishment has said it is 1:20 ratio. For a nurse, it's like 1:5. Now you tell me, who is monitoring the patient better, the doctor or the nurse? Now these junior doctors, when we are going out in the market, this concept is there, but the manpower is, the resources are so limited. We are going ahead and picking up boys and girls who had just passed out, done their internships, still in making of a doctor. So most of the time, a consultant, I don't know, Dr. Dutt would like to comment on this, they actually call the sister in charges. They're more comfortable taking the feedback from there than a resident doctors. So here lies another blockage, because the notes they're putting in the record is actually not helping us. So we are largely dependent on the nursing notes rather than the notes of the doctors, because every time it's like case seen by so and so, and then there is a note and the consultant writes it. But when you go to a nursing notes, it's much more detailed. So this is another thing. So I think they need a lot of training, and I think we need to look out of the system and find out what else we can do, what kind of training can we give the nurses more to get into more detailed reporting. And for the resident doctors, we need to understand that where do we stand? Do I really depend on pass outs just completing their interns, or do I really look for doctors having minimum 2 to 4 years of experience and in specialized wards and ICU, where this, because the record digital help I will definitely get, but what is the context and what kind of product is in that thing, I'm not very sure about it. So that's a major challenge. But I'm sure the technology, the way it is going ahead, I think we all need an app-based kind of system as far as electronic health record is concerned, because you have to see my parents, they're very sick at the moment. In fact, I was traveling to Chennai last month because of my parents. Now, I have done all investigations and everything is with me digitally. Okay, I'm carrying it on the phone, on my tab. The doctor is telling, film kahan hai, you know, because I'm going to give the film. And then because I'm telling you, I'm carrying an insurance card. Now, why can't the insurance card get integrated with my healthcare record? If my same insurance card is applicable in Kolkata and applicable also in Jharkhand, or in Ranchi, or in Chennai, or in Mysore, why can't my record also travel like that? Why not? I can definitely have this data security and all this. I don't know, the big shots will talk about it. But as a lay person, of a daughter of two ailing parents, I'm not there to carry a bunch of records like this with me every time I'm traveling. Why can't my insurance card get integrated with the AHR? And they get to see my data. I mean, I don't need to carry my mother's full body MRI, head, neck scans, and you know, all PET CTs and everything. So this is how the things are. So that is the main challenge I'm facing at the moment. I think we need to get more into this data management and access to data.
So I'll come back to your data related point, but the challenge what you are facing today, probably that is going to be addressed when Ayushman Bharat Digital Health Mission is going to be completely into action. And we heard just before lunch, the project has taken up and the kind of progress it has made. And I'm sure if it is not in a couple of years, maybe in 3-4 years, that is going to be reality. Whether that time you will require that much of support, I don't know, but probably when will be, you know, geriatric population, it will be helpful for our next generation to meet doctors with those reports. So I come back to Mr. Sudhanshu and I take all their points. You are one of the solution provider probably here on this dais. Everyone has spoken about data, teleconsultation, records, images, so many things, but all these are possible only when you have a solid IT infrastructure which can support you and you have a robust, you know, backbone to support in wherever they are in the world and trying to, you know, work with this data and record. And for that, we have heard about cloud, and cloud is the solution. So can you talk about that, what exactly this cloud technology is going to bring, and do you feel it could ensure better healthcare solutions in coming days?
Thank you, Joy. Thank you for giving me the opportunity to speak. As you already mentioned, my name is Sudhanshu. I'm representing Ozone Telecommunications here. We are a contact center as a service company. We provide a contact center solution on the cloud, and it's one of the fastest and easiest to deploy contact center platform, which provides a complete omni-channel experience for customer experience. That was a little bit of an introduction. Coming to your question about you know, the impact of technology, impact of cloud on healthcare services. See, there was a lot of pressure on the whole system, as we've all talked about in this session as well as the previous one, when the pandemic hit us, right? Overnight, the entire world saw big change, and the healthcare delivery came under a huge pressure because the pandemic, of course, you know, the whole thing was about healthcare and healthcare delivery. And with the lockdown in place, with the kind of fear of infection that is going around, and you know, people wanting to do everything remotely, and lockdowns being enforced, etc., across the world, suddenly a lot of things which were taken for granted became unavailable or inaccessible. And that's how the whole concept, and somebody said that, you know, in the previous session, I think one of the speakers mentioned that pandemic came as a blessing in disguise as far as digitalization of delivery, service delivery was is concerned. A lot of people who were especially, you know, and I don't want to again go on beating the physicians, which a lot of people have done, that, you know, their adoption of technology is the slowest. That may be the case, but you know, they also suddenly became more open and more amenable to adopting technology in this era. You know, at Ozonetel, we found that, you know, suddenly our services which we had to give a lot of introduction, justification, and clarification to people about, became much more easily acceptable by people. Overnight we were able to shift whole call centers, all agents, to work from home rather than from a one single facility, because everything was shut down. Within a matter of hours, healthcare delivery companies were able to provide patient engagement, patient experience, patient connect through agents working from home without any disruption in service. It was a seamless transition, not only for workforce management, for business continuity, for scalability, flexibility, all kinds of aspects of service delivery without any disruption. And I'll give you examples of some of our customers like home healthcare at home, or Portia Medicals, or Dr. Lal Path Labs. Some of them were able to move their services overnight from a facility to a work from home model just by because, and what facilitated that? Because the entire service was being delivered from cloud, right? If it was a hardware-based brick and mortar service, shifting it from a facility to a home would have been that much more difficult. But because it was on the cloud, so the cloud actually offers you a kind of flexibility, scalability, speed, and business continuity like never before. And the more we start using it, the more we realize that how easy it is to use services, to deploy and use services over the cloud as compared to a brick and mortar facility, because of situations like what we've gone through in the last 2 years. The other advantage that cloud offers is as far as security and data privacy is concerned. A lot of people often question that with my data not being in my physical vicinity or proximity, maybe I'm losing control over the data privacy or the data security. Actually, contrary to the popular belief, cloud because of the laws, the global laws prevalent in the world, the HIPAA compliance, the GDPR compliances, and a lot of government regulation and a lot of self-regulation by the industry itself, the cloud actually provides you much more safe security, much more privacy than some of the other models that have been in existence before. So this is what I would like to say. I mean, I can share a lot of interesting stories and a lot of anecdotes that we have experienced at Ozonetel during the pandemic, which have really enforced our belief in how customer experience can be not only enhanced, but made much more enjoyable, both for the providers as well as for the customers, and in this case, the patients, where, a lot of time the technology that is talked about in the healthcare space is at the back end. It is in terms of the healthcare delivery. But the patient experience, the patient engagement, and the confidence that the patient feels in interacting with a particular provider or a doctor, which often gets diluted when you're doing it remotely, can be enforced by using technologies such as ours. So that's all I would like to say, moving on to the next speaker. Thank you.
Thank you very much, and I think you have given very concrete answer in terms of that why it has to be used, because there are many providers still today have the same fear that it is going to be out of my hand, out of control. So to all the panelists, I'm going to have the second round, but try to keep your answer within 2 minutes, because organizers are maintaining time very nicely. We need to respect that and we need to follow that too. So with this, I move to again Manisha. The question, you come from a oncology chain. So in one side we are talking about IT and all, but can you talk a little bit about the technology related to cancer care? What are some of the new technologies and what are the challenges related to its implementation?
Yeah, so I'm going to be very prudent on time. I already spoke about some of the digital interfaces, patient-facing app, etc. that we are making. But cancer-specific, 2 examples. One is tumor board is a way of practicing oncology treatment. It is a multidisciplinary counseling slash diagnosis slash a full patient-side meeting by a set of doctors across radiation, surgical, and medical oncology specialties. And this is something we do virtually, which is, I think, very niche and unique, because we have a set of super specialists and we follow a hub and spoke approach. We have a large network and large footprint across the country with 23 hospitals, and in our center of excellence, we have doctors sitting there and virtually conducting this tumor board to do this counseling for patients across India. So that is one. And second, there was some talk of virtual reality already in the previous session, but we have recently partnered with Microsoft on their HoloLens 2. They have come up with it. It is in the virtual reality space. It's really it's a remote assist device that enables a doctor, for instance, in an operating theater, to use this three-dimensional environment interface and live stream what he or she is performing in the theater to another doctor placed somewhere else in this different city, country, wherever, who is by means of this 3D interface seeing exactly what is happening and can directly annotate and guide the surgery remotely. And this is quite a breakthrough because this is like proctoring. Conventionally, how proctoring has happened is doctors come and they stand in the same operating theater, they guide the juniors or the new doctors, but this is literally virtual proctoring that we are doing. This is in addition to everything else that I mentioned. In terms of challenges, I think from provider perspective, I think there's been a lot of talk on data security, data privacy, so I won't get into that. But from our side, one is very hygiene, but presence of good IT infrastructure. I think that is a concern for a lot of providers. Already our infrastructural systems are strained because there is a lot of load coming because there is so much more usage of connected devices that are bandwidth intensive, which are stressing the infrastructure more and more. So I think IT infrastructure hygiene, but is a very basic fundamental requirement, also poses a deterrent in implementing solutions many a times. And the other piece is, and a lot of chat on why are doctors not adopting or why are nurses and stakeholders not adopting. And the flip side to that is user interface, and how do tech solutions make the user interface friendly and convenient. Whenever we sell anything, a basic salesman strategies, you put the value proposition in such a way that the person realizes, okay, this, and the stakeholder here is your doctor realizes this is actually saving my time, and I actually spend more time writing down on a piece of paper than the time that it's taking me to do this online. So how to make the user interface, same goes for nurses and all the clinical, non-clinical stakeholders who use it, is how can tech companies and how can technologists today design and make the user interface very friendly and convenient to use. I think that's very important, and that will help all of us as providers also to do the change management which is required, because really the challenge is change management, and this is really a prerequisite for doing any sort of change management. And lastly, I think she gave her personal example, but I think interoperability is very important. Interoperability across systems, across, like she spoke about health records, personal health records, across different network of hospitals, across cities, even within the environment of same organization. How does, when we use a new solution, how does it seamlessly flow data across two environments, across two systems, to databases? I think that would be another challenge.
I'm sure some of the solution providers are here and they'll be looking into it, and most of us are challenged with this interoperability, seamless data flow and all this. So thank you very much. So I go to Dr. Charu Dutt, and the question I want to ask him, we spoke a lot about the telemedicine and practice like that how this telemedicine and this practice has changed the healthcare practice in post-COVID era.
Great question, Joy, and I'm going to stick to the time. First of all, real big comments on Suparna's talk. I think two things which doctors are very bad at learning. Number one is how to save money, because they are pathetic with investments. And number two, how to work on computers. These two things are the biggest challenges doctors face. When I moved from the States 6 years back, I understood that doctors here have a lot of habit of writing and completing their forms, looking at patients, as compared to where I was trained. They're completely working on cow carts, and they it doesn't really matter if the patient is sitting in Guam in an island or somebody who's in Los Angeles or somewhere else. because they are just getting all the access, which is extremely seamless, continuous, and integrated through a cow cart. The second is the training. If they're trained properly at a young age, that's the biggest fault of our examination system. Our examinations are still focused, instead of clinical scenarios, but on theoretical practices. And the third is the accreditation system. Suparna very rightly pointed, and that's what I practice. I still rely on my physical therapist. I speak to my physiotherapist on how my patient is doing at home. I speak to my nursing superintendent, on my nursing supervisors, on how my patients are doing at home, rather than speaking to the resident doctors who are visiting home and giving me a case seen by, because most of the time their basic notes on their neurological scales are also incorrect, and which is a shame, because most of the times they're just working on the theoretical practice and not looking at the clinical scenario, what the patient can anticipate or how can I predict what's going to happen. So the accreditation system is made in such in India that the entire focus is on the nursing. The paperwork is very thorough. The knowledge is not my thorough, but the biggest hindrance is the the kind of the ownership or the authority that a nurse is given in an Indian healthcare system. We are still lacking the fact that nurses are given an equal authority. We are still lacking the fact that the holistic and multidisciplinary approach is followed, a huddle round, and all these were actually taken over by telemedicine. In COVID, everybody had to. There was no other option. Doctors never liked telemedicine. They had to. When you look at the counterpart, now post-COVID, patients love it, but the doctors don't. The doctors are still wanting the patients to come and fill the hospital beds. It's not about filling per se. It's not about a business strategy. It's about understanding. We are trained in such a way as Indian doctors that till we touch a patient, we can't make a diagnosis. Although we say that but weren't we able to make diagnosis during COVID? We really did, right? But we still think that we were giving under treatment, or we were not giving 100% equal efficacy. But that's not correct. It's just the training, it's just the psychology. I have seen that one of the biggest branches which has gone almost 100% tele is dietetics and nutrition. 95% right now, 95% is my data post-COVID, wherein the patients are getting their diet consults, their weight loss, their PCOD management, their thyroid management, their endocrine management, with a dietitian and a clinical nutritionist through phone. Is their efficacy bad? Are the results not coming in? That's not correct. Because that's one branch of science or healthcare which has been trained in such a way that even if they do not touch, or if they give an equal efficacy teleconsult for 45 minutes, that's good enough for them to make a diagnosis, a thorough symptomatologically efficient diagnosis and management. But that's not the case with doctors. So although doctors are not loving and not liking telemedicine, they had to do with COVID, but we are using a software at our home healthcare department, although it's not a paid promotion hashtag. It's a Japanese technology called as Vios. Now, Vios is one of the software which is an AI-enabled software, and I, sitting in one of my headquarters, is able to manage all my patients across 6 locations across India, and 1 patient even in Nepal for that matter, wherein I can see if the patient's bed position has been changed or not. If a bedridden patient with a stroke not getting enough positioning changes has a huge chance of developing a pressure ulcer. Now that's a quality indicator which I cannot miss. So that is why that software gives me an audio-video recording of how my patient is doing, whether the vitals are being monitored properly, are the drugs administered on time, whether the insulin has been given, and we are trying to build in a network where we can also manage on how the patient's oxygen monitoring or a rapid diagnostic machine, or maybe as complicated as changing the parameters of a ventilator, can be managed by a senior physician sitting at one part and managing others. So we are trying to make it Bluetooth enabled, completely touchless, and I think we are one of the first ones in the country to do that. So, but again, I'm reiterating, it's all education and awareness. 100 people sitting here, 5 people talking here, doesn't make a difference. If you go to the tier 2 and tier 3 cities, still the MBBS education here doesn't give a focus on geriatrics, doesn't give a focus on community medicine, doesn't give a focus on nutrition. Forget telemedicine. Arogya Setu has changed the way Indian people have seen. It has turned, now even the, all the transplants are gonna be compiled into Arogya Setu-like app. So when people are adapting, when the entire population can adapt, why can't a set of doctors can adapt? It's only because of our education system, our examination system, and our accreditation system. So till these 3 points, till these 3 barriers are not taken care of, there's no point of discussion.
apart from what you said, I think one of the very significant point you have touched at the initial part of your response about healthcare delivery team, where everyone must have an equal voice, which is lacking, and probably some sorts of training and all can bring this change. Now, I move on to Dr. Ms. Suparna again. The question is, if you have wish list, everyone has spoken about artificial intelligence, this, that, and all. Talk to me, tell audience about any 2 to 3 technology what you feel should come up fast and should address what kind of challenges.
I think I go back to the primary healthcare level, because preventive health is what we are there, we have to be there. So I start from there. The number one is preventive health mechanism, like how fast the hub and spoke model can take place, I don't want people to travel distances for a health check. I don't want them to, rush to a doctor, what about my vaccination schedule? I don't want the TB, the largest public health issue of India, the TB adherence system which we developed, to come into effect as fast as possible, because it is taking a very, very long time to settle in. So this is my first. Second is EHR. I would personally, it's a very, very dear subject to me, because I once met a person from Paramount Insurance around in the year, I think 2015-16. I only met one guy in my 23 years of career who is coming to me and asking, ma'am, how can we integrate our Paramount card holders with the medical record? So it was only one insurance people, but if everybody starts thinking that, that as Sudhanshu was mentioning, that the cloud is giving us the maximum security possible. So if everything is taken care of, why can't the EHR take place? And what is it which is stopping it? Where is the blockage? I am not understanding. If people are like flying money to the moon and to I don't know from where, I don't know why it doesn't happen. So EHR is my second point, and that is the only 2 requests I have. Wish list.
Thank you. And last question to Mr. Sudhanshu, and I think you have to be very brief because she is already there before she throws that out from the podium. So question is, I heard and you have explained that how nicely during COVID you have managed the call center and all, whereas always we feel that if there is a call center for anything that doesn't answer, we don't get a response. But that worked beautifully in case of your COVID, what you have done. So can you share some reason for this success? What have you done differently to make it really impactful?
Yeah, I think, very good question. See, as somebody said, necessity is the mother of invention. And this was also kind of driven by the necessity or the need of the hour. We were fortunate to have got the opportunity to set up a few COVID helplines as well. In a lot of these states like AP, Telangana, Haryana, Karnataka, Delhi, a few others as well, we were running the COVID helplines for the government healthcare machinery. And there, these lines were not only used for making outbound calls to patients to check on them, but also incoming calls to assure the patients about ambulance availability, about hospital bed availability, about oxygen cylinder availability, etc. And it was during that time that you saw how when there's a desire to do something, how the entire universe can come together to make it happen. For example, in the state of AP, the government decided on a Monday morning that they have to set up COVID helplines. And the CM said, I would like to inaugurate them on this Sunday, right? Typically, on a situation like that, they would release an RFP or a tender, they would invite bids, and the whole red tape and bureaucracy will take 3 to 4 weeks, 6 weeks at times to come to a decision, then award it and implement. Here, they took a decision, they cut through the entire red tape within a matter of 3 to 4 days, and on a plan which was decided on Monday, the contract was awarded to us on Thursday evening or Friday. And we were told that, can you set it up on Sunday? I said, yeah. We said yes. And we actually had it up and running on Sunday, and the CM inaugurated it. And it all happened because of the confidence, the trust and obviously the technology that cloud offers us, you know, the advantage of being on cloud, because you don't have to procure hardware or set up, find space or find the necessary infrastructure. It all had to be done on cloud. It was done. It was running seamlessly. The Chief Minister inaugurated on Sunday, and from Sunday evening onwards, patients were being supported. And we did this in multiple states. So, you know, where there's a will, there's a way, as they say. And we experienced it during the COVID, and I hope the same kind of energy and enthusiasm we can sustain in delivering healthcare, especially in the kind of areas that Suparna talked about, the primary healthcare and, you know, of course, and the preventive healthcare. If we can do that, it can be a game changer for this country and for the world. As in the previous session, one of the speakers talked about that education and healthcare, you know, right from Mahatma Gandhi's time, these are the two areas which have remained a challenge for the last man in the line. And they continue to remain a challenge. If we can use the technology, especially the cloud technology, to reach these people and deliver this service, I think it can be a great blessing for this country. Thank you.
So thank you very much. I will not take much time to close the session, and we'll stop with one point, that is, he mentioned if there is a will, there is a way. So I hope all of us will have that strong will and we'll have a very clear way ahead of us. Thank you very much to all the panelists for giving their inputs and making it an excellent deliberations, and thanks to the organizers for giving us this opportunity. Thank you very much.
Thank you so much, sir. I'll request Dr. Ravi Gupta to please join us on stage and felicitate our panelists here. Mr. Joy Chakraborty, Chief Operating Officer, PD Hinduja Hospital, who wonderfully moderated and orchestrated this session. Can we have the memento on stage, please? Can we have a round of applause, please? Thank you. Ms. Suparna Sengupta, Chief Executive Officer, Narayan Memorial Hospital. Thank you so much, ma'am. Ms. Manisha Kumar, Chief Operating Officer, HCG Hospitals. Thank you so much, ma'am, for joining us today. Can we have a round of applause, please? Dr. Charu Dutt Arora, Founder, Member and Head Consultant, Asian Institute of Medical Science. Thank you so much, Dr. Arora, for being here. Mr. Sudhanshu Mishra, VP Business Development, Ozonetel. Thank you so much, Mr. Mishra, for being here with us. May I request all the panelists to please give us a group photograph with eHealth magazine that has been catalyzing healthcare since 2005. Thank you so much, and a huge round of applause, please, for our panelists. Thank you once again to all the esteemed panelists.